Chapter 6: Somatic Symptoms and Related Disorders and Dissociative Disorders. This is my summary of Abnormal Psychology, 7th edition by Barlow and Duran. Starting off, the somatic symptom disorders are excessive or maladaptive responses to physical symptoms associated with health concerns. Dissociative disorders. These are disorders that relate to dissociations from identity or consciousness. So basically like splitting your own self into other selves. It used to be called split personality disorder or multiple personality disorder, and then it's now called dissociative disorder because it's separating parts of yourself. I made a video about psychoanalysis, which would be useful in regards to this topic. Moving along, hysteria are when individuals overreact, but the physical symptoms that cause this overreaction is not known, and thus it creates dramatic behavior. Conversion, according to Freud, is a change of unconscious emotional conflicts or contents into physical symptoms, into something that is perhaps more acceptable. So, for example, feeling very angry about something, but suppressing that anger, making it more hidden. But unfortunately, as with the state of the unconscious, these things build up within the individual, and then thus they manifest themselves as physical symptoms, such as if one is very angry, maybe it might manifest itself as more pimples or something like that, because like more cortisol in the bloodstream and so on and so forth. This is just an example, don't take my word for that. Anyway, illness anxiety disorder, aka hypochondriasis, or severe anxiety distress, is derived from the possibility of having or developing serious diseases. It's a fear of being diseased, the fear of having a disease that drives anxiety, which is also strange because in essence they have this anxiety disorder, which itself is an illness, a disorder. Moving along, psychological factors that affect medical condition. These can include somatic symptom disorders, as well as the presence of diagnosed conditions like asthma, diabetes, severe pain, etc. Conversion disorders. These are physical malfunction like paralysis, blindness, and difficulty speaking or aphonia without physical or organic pathology to account for the malfunction. So it is an issue or a problem that has no known cause. Malingering is faking a physical disorder. Factitious disorders. These are symptoms of which are under voluntary control, but there isn't an obvious reason for producing these voluntarily, unless the patient is using this to seek more attention. Derealization is a sense of reality of the external world being lost in the individual. So they become, I guess, dissociated, disengaged from the world, something like that. Depersonalization, derealization disorder are severe feelings of unreality that dominate and frighten individuals, preventing them from functioning normally. Generalized amnesia are when people who are unable to remember anything include who they are as people. Localized or selective amnesia is the failure to recall specific events, usually traumatic events, and these are common in war and are intense emotional reactions that cause forgetfulness, and there's an absence of subjectivity for certain events. So they're unable to feel what really happened in that event. The word fugue means flight.
A fugue is a rare psychiatric disorder characterized by reversible amnesia for personal identity.
An example of fugue is dissociative fugue, whereby memory loss revolves around specific incidents and these produce an unexpected trip. Dissociative trance. When individuals are in a trance state, they believe that they're being possessed by other people or evil spirits. Dissociative identity disorder is the adoption of many identities that coexist simultaneously. Each identity has their own behavior, tone of voice, physical gestures, and identities are only partially independent, and few characteristics are distinctive. Suggestibility is a personality trait distributed normally across the population. Auto-hypnotic model are when people who are suggestible may be able to use dissociation as a defense against extreme trauma. So, in a way, is like hypnotizing oneself, but in this case it's just dissociating oneself from the situation. Too much trauma, they just shut down. So yeah, we looked at somatic disorders, and join me next time whereby I discuss about mood disorders and suicide. Thanks for watching.